Joining us now is Vice President Mike Pence. Mr. Vice President, good morning to you.
Morning, Savannah.
Well, let's just start right there with what Dr. Fauci said and settle this once and for all. This is much more lethal than the seasonal flu, correct?
It is, Savannah. According to all of our health experts on the White House Coronavirus Task Force, it does not, as we look at global data, present as much a threat to younger Americans, particularly children under the age of 15, but for senior citizens with serious underlying health conditions, it represents a threat of very serious consequences.
Okay.
It's one of the reasons why the president took the unprecedented step yesterday of suspending all travel from Europe, just that he has done so in
Yes.
January with China. And we're going to be screening and asking every American who returns from Europe over the next 30 days to self-quarantine for 14 days.
Yes.
We want to focus on those that are most vulnerable, but we also want to work on ensuring that the coronavirus is not further brought into our country from Europe. And we're obviously continuing to focus in areas of California, Washington State, and New York, where we've seen what the experts call community spread. It's that combination of efforts that we're addressing because of the threat.
Yeah, I'm hoping that we can just get a lot of facts out in the few minutes we have together. Just leveling with people. The president has said, as recently as 2 days ago, this will go away. Yesterday, Dr. Anthony Fauci said you can expect millions and millions to get it. The worst is yet to come. Congress's own doctor said that a third of the American population could get coronavirus. Do you agree with that number? What do your experts tell you the number of infected Americans is likely to be? A number. I'm looking for a number if you have it.
Well, let me be clear that from early on, the president has declared a public health emergency, suspended all travel from China. We limited travel and issued advisories for portions of Italy and South Korea, and now the suspension of travel from Europe, precisely for the reason that we know there will be thousands more cases of coronavirus in this country.
Thousands or millions?
But well, I'll leave to the experts to make the estimates of how many people may be infected. And it's important for your viewers to remember, Savannah, that the vast majority of people, even that contract the coronavirus, will experience flu-like symptoms and they'll fully recover. But it's because of the vulnerable population, seniors with serious chronic underlying health conditions, that we're focusing so much attention on nursing homes. We're communicating so much with health officials and families that have seniors in a vulnerable condition. We're looking at the most vulnerable. We're combating community spread. But the action the president took yesterday, again, unprecedented action, suspending travel from Europe for 30 days, is all because we know there will be more infections in the days ahead. We're trying to hold that number down as much as possible. That's the reason the president took the action regarding Europe.
No question. And we're seeing unprecedented actions on the behalf of sports organizations, companies, travel, all across this country.
Right.
Let's talk about testing. There's no catching up to this or even trying to slow it if you don't test. South Korea, whose onset was roughly around the same time as the U.S., is testing roughly 15,000 people a day and says it's tested more than 100,000 people overall. Every indication is that the U.S. has not tested anywhere near that number of people. Why not?
Well, from early on in this effort, we've been addressing the testing issue. We made changes through the FDA that allowed for state labs and university hospitals and hospitals to engage in testing. And I'm pleased to report every state lab in America can do testing now. Many university laboratories are doing it. Washington State, the University of Washington, is doing extraordinary work. But we are literally working hour by hour to expand the testing. And we think the key, Savannah, is going to be what we call commercial laboratories like LabCorp and Quest, who are already spinning up production at the president's direction last week on tests that can be available on a broad basis in the days ahead for the American people. We're making real progress. But rest assured, we're going to continue to drive forward. But anyone that feels that they may have contracted the coronavirus should call their doctor. Their doctor can contact the state lab and determine where testing can take place today in all 50 states.
Was there a little bit of a lag time, slowness about testing in particular? The World Health Organization in February sent out a coronavirus test to 60 countries, but the U.S. was not among them because the U.S. wanted to develop its own test. Was it a mistake to not just take that WHO test while we waited to develop our own test so that the testing could ramp up earlier?
Well, it's a fair question, and Dr. Fauci and I were talking with congressional leadership in both parties last night, and that topic came up. And what Dr. Fauci said was that's actually not the way we do it in the United States. Frankly, we're the world leader in infectious diseases. Our CDC and then our FDA produce and approve tests through our incredible healthcare system in this country. And so that's more of a reference of that decision, according to what Dr. Fauci said. But your viewers should know that we are continuing to lean into this effort. The president tapped me to lead the White House Coronavirus Task Force about 2 weeks ago. We brought in all of the leadership of course, health insurance industries, nursing homes, bankers yesterday. But we brought in those commercial labs like Quest and LabCorp that are already on their websites, already producing more tests for Americans. Yeah. And the good news, as the president said last night, is any American who feels that they may have been exposed to the coronavirus or has symptoms can know that because of the president's leadership, all of our health insurance companies have waived co-pays on testing, have agreed to extend coverage for treatment, and we've made sure that Medicaid and Medicare recipients in this country have the exact same benefit.
Okay.
The person's financial situation should not be a barrier to being tested, nor should the risk of losing your job. The president's going to continue to drive for family leave benefits for hourly workers, for small businesses, so that anyone who feels they may have been exposed can stay home without fear of losing a paycheck.
And Mr. Vice President, I know you have another interview, so I got to jump. I just want to ask you real quickly. Unfortunately, this has been infected by politics like so many things. And some people think this is just hysteria and media hype. I mean, the president himself said on Monday the fake news media and their partner, the Democratic Party, is doing everything to inflame the coronavirus situation. So there are people out there who believe this, and they are going about their business like nothing's going on. And we have about 10, 15 seconds for you to get your message to them, for people who aren't afraid of coronavirus and think it's just politics and hype.
Well, obviously there's been some irresponsible rhetoric. But the American people should know that President Trump has no higher priority than the health and safety and well-being of the people of this country. You can go to coronavirus.gov right now to find out what every American can do to keep yourself, your family, your workplace, and your school safe.
Thank you.
But you can rest assured we're going to focus on communities where we've had community spread, and the president's action yesterday, suspending travel from Europe, is one more example of how he's putting the health of America first.
All right. I know you're taking it seriously, Mr. Vice President. Thank you very much for your time, and I'll let you go. Appreciate it.